Okay. Hi, my name is EKTAA. I work at Section 27, and we've been working quite closely on the People's NHI with PHM. So I'll be speaking about the quality of care, and I wish that I took out that poor before the service delivery now that I'm here, because we just want to talk about service delivery. But I'm glad that the word quality came up quite a few times today. So I just want to ask you what your understanding is and what your experiences are. Most of you have had interaction with the public health system, and so what your experience has been. Yes, Louis. How would you describe the quality of healthcare at public facilities?
So I had a huge operation in 2010. No, in 2000. Sorry, it's almost 20 years ago. I had a mitral valve replacement. That's a big heart operation. All my friends said, go to the private sector. I said, no, I'm going to use the public sector. So I had my operation in the public sector. And technically, it was very good. But remember, this is a public sector that's been suffering austerity. So anyway, I did at this hospital across the road here. And during that time afterwards, the care was, now I worked in intensive care unit at Red Cross Hospital as a pediatric intensive care specialist. And there was one night when I was having blood tests. The person doing the blood test was a nurse, an agency nurse. She'd been outsourced. This is one of the things that happens, that people get outsourced. They bring nurses in from an agency who are not used to working in that particular area. She took the blood, and I know how to do that blood test. You've got to take exactly the right amount. It's got to be mixed gently, and then it's got to go for the test to the laboratory. She took blood. She didn't even look to how much she'd put into the tube. Then she put the thing down and started doing some other stuff, and then she came back and shook it up. And I knew that this result was not going to be a good quality result. But I didn't do anything. It's sort of, I think the health system makes us vulnerable. Even though we're professional colleagues, I didn't kind of do anything. It's amazing. And in the private sector, the same thing happens, I can tell you. The private sector quality of care is not great. But that was a kind of a thing about outsourcing, about not having a proper human resource working in the facility. So anyway, that's my little experience.
Hey, this is very interesting to talk about the quality service, especially when you mention the name poor. I think for our brothers and sisters who are employed by the Department of Health and the agents, they have been put in a small bin where they are supposed to be operating as like 100 bins in those bins, but they are not been given the structure or the resources to do what they're supposed to be doing. Because for me, I once went to a clinic and I know exactly what I went for. But unfortunately, the nurse who assisted me doesn't know what she was doing to me. You can't ask a patient, how do you feel? What's wrong with you? So you give me another information, because I understand that you went to school, You went to tertiary because you've been educated for this. So if I'm saying I'm sick, you should examine me. You should not ask me because I don't know what I'm sick of. You should not ask me what is it that I'm sick, because if I knew it, what is it that makes me sick, I should take something and treat that. But I go to hospital to access a service because I'm sick. And this particular issue, and she asked me what was the issue, and the issue was normally I react normally on, I don't know what I react on, but if I eat something or then I get a rash or my face is like swollen or something. And then I told her that I wake up this morning, my face like this. And then she said, oh, probably you ate something that does not allow, your antibodies do not allow what you eat. Tell me your daily routine of eating. Then you can't remember what you eat yesterday or a day before. Remember, we are from disadvantaged communities. Probably I ate a meat, a red meat or whatever, and then apparently I react this morning. And what I experience is that on Mondays, every Mondays, I wake up in a wrong state of me. Then I take allergex. That's what I know. And I went to the clinic knowing that if I take allergex, this thing will go away. But I want to prove a point to the particular clinic. Then she said, okay, I need to take your blood for a sample or something or whatever. I said, no, you're not going to take my blood. If I was going to tell you the problem, you won't believe me. And then she said to me, okay, you knew that you have a problem and you have a solution. I said, no, I don't have a solution, but I knew my problem. And I'm requiring help from you because you're a qualified nurse or sister or whatever qualification you have. But all in all, what I'm saying is that the issue in our clinics, especially in our communities, is that when you enter, they are always frustrated because they know that they can't always satisfy all of us with our needs in terms of getting help in our clinics. I took one brother to a clinic who was having a piles problem at night in KTC 24-hour hospital. They gave him pain blocks. They could not even ask him. He could not sit. He only stand. He could not sit on the chair. He was not walking like normally because the pains was too much. The piles was like almost, the doctors are saying it's visible. It's out there. So you are no longer able to control yourself. Then I explained the situation to the emergency side because they only open for the emergency. And then they say, how do you know that it's piles? I ask, and bear in mind that the person who's asking me is the security, not a healthcare worker. Because I need to explain to the security at first before I reach to a healthcare worker who's going to assist the patient. Apparently, that guy did not receive help. He could only get pain blocks that you can go to a pharmacy and buy it. So it's very frustrating when we're talking about this.
Okay. Hey, mine, what is puzzling me is the very same thing with the education. You will notice that the teachers in public school are sending their children in to private schools. Why? It's like, I don't know how many nurses who don't have their medical aid schemes. No, a nurse prefers to be treated in a private hospital than in the public hospital where she or he works. I mean, that's very obvious. If you are going to go to Kukuletu Community Health Center, your history will be moving on chairs. You know, you sit on chairs, I don't know for how long. For an example, as a person who attends a club, the time is going to be written on my card. I must be there for a treatment by 7:30. And I'm there already by 6 o'clock. But when they start treating me, yes, it's about 9-ish. I don't know whether it's the lateness of the medical care workers or what, but they are always not on time. You will stay there almost the whole day. But if you go to a private clinic, it's quick, and you go home, you feel better. You get worse when you are in the hospital. In my experience in Cooks, I get sick more when I'm in hospital than I'm at home. If I'm at home, I feel much better. But if I get to the public hospital, that 24-hour service is no longer a 24-hour service. I don't know what it is, but I will tell you, the nurses that are working there, they have got their medical aid schemes. Why is that? It's a proof to me that they know that they don't deliver. So for their families or their children, they must be treated somewhere where they know that the service will be delivered. So I don't know. It seems as if we are just thinking we're racing to the bottom every day. We are racing to the bottom instead of getting improvement. That's my experience.
Okay, so as we can see, we can't use a one brush to fit every experience in the public health sector, but overwhelmingly, the experiences are negative, and the public sector is portrayed as offering poor quality services, which is not surprising given the budget and the financial resources allocated to the public sector. There's health system failures, like you've mentioned here, long queues and waiting times, staff shortages, and stockouts. But there have also been some good health system reforms and some improvements in access to health services, like the ARV program. In PEPFAR's recent report, they said that of the 4 million people initiated on treatment, within a year, only 2 million were still on treatment. So it's showing a reduction in adherence to ARV treatment. So this is a Saving Babies triennial report, which shows that the perinatal mortality rate of between 2014 and 2016, the average between those years was 30.6 per 1,000 births. So that's babies dying either at the fetal stage or in the early weeks of being born. So David's presentation showed a lot more of what the state of healthcare sector specifically is with regards to maternal and child health. So we're at 30.6, and some of the lowest countries in the world is Afghanistan, Somalia, DRC, and their average is about 29. So we're actually worse than them. How bad is it? The OHSC, which is the Office of the Health Standards Compliance, in their report, firstly, they only examined 18% of facilities. So it's about 690 out of about 3,800 facilities were inspected. Of those that were inspected, only 5 facilities met the required 80% status. But even meeting the requirements of the OHSC doesn't necessarily translate into good health outcomes. So there was a study done in the Western Cape and Gauteng, which shows that even at facilities which met 70% of the OHSC standards, they still had a very high maternal in-facility death rate. In Gauteng, it was more than 7 times what it should have been, and in Cape Town, it was more than 4 times what it should have been. So we are lawyers, and we love regulatory frameworks, but unfortunately, the right to health is not as detailed or as strong in frameworks as we would like. So I won't go through this, but just to say that I'm sure you're aware of the constitutional provisions that everyone has the right to have access to healthcare services. But there's a qualification to that the state must take reasonable legislative and other measures within its available resources to achieve the progressive realization of this right, which means it's not immediately realizable unless it's applying to children. So the National Health Act is the legislation which is the overarching framework which deals with the health system and the interaction between the health user and the system. So the Health Act says that you have a right to complain about treatment you receive at a facility. And the procedure for making a complaint must be displayed in facilities. And if you have a complaint against a specific health professional, you can take it to the HPCSA or other regulatory bodies of that health professional. The NHA also establishes the Office of the Health Standards Compliance, and this is a body, it's a fairly new body created to create standards and criteria to promote good service delivery. It also creates the Health Ombud, which investigates complaints relating to standards. So in Life Esidimeni, the complaint regarding facilities where mental health care users were moved to was initially made to the Health Ombud, which resulted in a report by the Ombud, which eventually went to the arbitration. The Health Ombud also did a report on the Tower Hospital, the mental health care hospital in the Eastern Cape, but unfortunately that report wasn't as solid because there wasn't enough participation and support given in that process on behalf of the users. So before the regulations came into effect, the national core standards were used. And they were a bit wider and a bit nice, but this year, on the 2nd of February 2019, the national norms and standards regulations applicable to health establishments came into effect. They're a bit narrower than the national core standards, and even though the national core standard still applies, these are regulations, and so they're a bit stronger and more legally binding. Generally, it deals with the standards that the facilities have to comply with, which is usually measured against some other guideline or standard issued by the National Department of Health. So it won't set out actual standards themselves. It deals with access to care and says that every user must be attended to in a manner appropriate to the nature and severity of their condition. Everyone should be entitled to emergency medical treatment. So users should be stabilized and then transferred to an appropriate facility on a referral. It says that there must be a system for health records, which must be kept confidential. There must be availability of medicines and medical supply. It doesn't stipulate what the level of that medical supply must be. In terms of infrastructure, it says that it must comply with national building regulations and that every facility must have a maintenance plan. And there must be a register for adverse events and a system to monitor adverse events. With regard to waiting times, it doesn't stipulate what a waiting time should be, but it says that it must be monitored against the national core standards, which just says that waiting times should be delayed where possible, and that waiting areas must be convenient and have adequate shelter. So the National Health Insurance Bill comes out in June 2018. August 2018, we get invited to a consultative meeting where the president was for the official release of the NHI bill. And with the bill gets released another report in the pack called the Draft National Quality Improvement Plan. So the president for the first time acknowledges that there is a crisis in the health system. Step one, which is good. So I won't go into the politics of the release of this report, but for the first time, this report accompanies the bill. It's a draft national quality improvement plan, and it recognizes that there are deficiencies in the health system and that there needs to be a system in place to improve the health system before NHI. So it's a very long plan, but when you read it, it actually is a plan for another plan to bring together a review of the existing initiatives, because there are many existing initiatives to improve the system, and find out which is working and which isn't working and why. So there were some good recommendations in this plan, like the lifting of the moratorium on the hiring of posts. So because of the austere budgetary climate, a lot of provinces have been hit very hard by a moratorium issued by provincial treasuries on the hiring of posts in the health sector. Gauteng, especially with the high accruals and medical negligence claims, they're simply cut off the hiring or the employment of any new staff. And obviously this had really detrimental impacts. So we're not sure how this is going to translate into practice, but in the 2019 budget review this year, an announcement was made that 2.8 billion rand would be redirected from the NHI insurance grant to an HR capacitation grant, which is good. But that's over the next 3 years. They also said that they would allocate 1 billion rand to the hiring of CHWs, but that will probably only come into effect in 2021, and that would be from the HIV grant. So these are all initiatives directly from national government. So they will be in the form of conditional grants going straight to provinces for a specific purpose and not allocated in the equitable share to provinces, which they can then decide to distribute. So the National Quality Improvement Plan refers to the Ideal Clinic program, which was set up to supposedly improve the quality of primary healthcare services. But unfortunately, there has been no progress reports on the implementation or of this Ideal Clinic program. And we work with a lot of clinics who have been identified ideal, but are very far from ideal in that they have poor infrastructure and HR, and there's lack of support given to clinic committees for their functioning. Operation Pakisima was introduced in 2014, which was supposed to enhance the Ideal Clinic program, and it made various recommendations, but there aren't any progress reports on what has been done with those recommendations. In 2018, 47% of clinics complied with the OHSC standards, and 43% met the Ideal Clinic status. And this is in the Quality Improvement Plan, these stats. The health review in 2017, the department said they were in a process of completing a schedule. The schedule hasn't been made public as yet, although there may be some sort of national infrastructure plan, which was referred to in the Health Summit report last year. So the big problem with public systems and the NHI is accreditation. So it came up this morning, the process of accreditation and the fact that facilities will have to be accredited before they provide NHI services. So the plan says that all health facilities designated must meet the standards of the OHSC, and thereafter 25% of facilities need to achieve accreditation by the NHI fund within 1 year. So firstly, the OHSC requires capacitation to be able to fulfill this mandate of assessing public health facilities. Their budget only increased by 5% this year, and their staff complement hasn't increased at all, so it will stay at 121. The additional criteria, besides meeting the minimum standards in the OHSC regs, additional criteria set by the fund, which is that the facility must provide certain services, there must be an appropriate number and type of health professionals, and they must adhere to treatment protocols and referral networks. And only in terms of the bill, only full compliance with these criteria will allow a facility to be accredited for the purposes of NHI. And obviously this has really this has implications for public health facilities and rural facilities, where there are no private facilities in areas where people only access public facilities, and if they're not accredited, the question is where will they go to access healthcare services? The plan also doesn't have any process to bring these facilities to compliance. So where are we going from here? Our suggestion is that there needs to be a review of existing quality improvement initiatives and an analysis of those initiatives and the pilot programs. There needs to be a human resources for health plan, which is funded and implemented, which includes training and placement of health professionals. There must be a revision to the National Infrastructure Plan, and the Health Summit report recommends alternative funding mechanisms for infrastructure. There needs to be a massive transformation for governance and management structures to prevent political interference into governing systems of health facilities. And there needs to be a plan to capacitate and resource clinic committees and hospital boards. At the moment, there are only 4 provinces who have regulations that govern clinic committees and hospital boards. And also a strengthening of the OHSC, of course. It isn't all gloomy. There is some improvement in the health sector. This was Village Clinic in Lusikisiki in 2013. It was just a tent and a prefab. And this was Village Clinic on Wednesday when we went. So I don't think it's a coincidence that the opening of this village was timed a month before the elections. But actually, this was as a result of 2013 litigation brought by TSC and Section 27 against the Department of Health, and the National Department undertook to do a refurbishment of this clinic, and that's been opened recently. Okay, questions?
Okay, we have very few minutes before the AGM, but there can be about 2 questions. Okay. Yeah.
From a point of your capacity as lawyers, what would you advise us to make our government implement, not speak in terms of those legislation and whatever that you understand as your capacity? Because for us, we know what we know is to go to Parliament and hand over a memorandum and come back to the same situation and wait for another talk and wait for another election or budget speech or whatever. But as you, as lawyers, and you understand very well the terms and conditions and whatever that you just presented to us, you understand it very well rather than in a civil society like me, who does not sit in those like desk or portfolios and get a chance to question them. So what would you advise us so that tomorrow, when I go back to the movement for social change and justice in my community, promise them that if we go to Parliament on the 24th of April and then over the memorandum, pushing that the Minister of Health must implement the NHI in our clinics, so that they can hear that, okay, this is something new that Isaac is bringing from PHM workshop. That's one question. And I think this is a comment. I'm really frustrated as a comrade from where I'm staying or from where I'm accessing healthcare service. From what you are just presented to us now, you just show us. I'm not sure if a gazebo, it's a tent or what, and you just show us a beautiful Vincent Pallotte Hospital behind you. It's really frustrating when we see those things, because we are talking about Eastern Cape, we are talking about Transkei, the areas where we are saying our leaders were born in those particular areas. But today, we are in the 21st century, but we are still struggling to get a simple, health, good quality service for our people. For how long we are going to go to the street and damage what is there already? Because our mind tend to forget that we are damaging. Obvious, at some point we are sick and tired, and we turn, okay, if we go to on a street and we protest and we damaged, we'll think about it later on or tomorrow that one we vandalized, it was already there, established, but because of frustration. So I don't know, but maybe you will advise, and please talk to your guys. I know Mark Haywood is in your department. Yeah, so
just to respond quickly to that, so we advise civil society that we work with, the most important thing is record keeping. So we often forget to, you go to a meeting, you'll engage the facility manager or the MEC or the HOD, and then you'll get back minutes from the meeting portraying their side of the meeting and not what you say and what would give you the power to use it at a later stage. So when you participate in clinic committees or any sort of engagement to improve your facilities, keep a record of it and start building a paper trail showing what the issues are, what attempts you've made, which can be used at a higher level later. So from grassroots level, I think it's very important to start doing that and organize ourselves. But we will be doing trainings for clinic committees. Yeah, so we can talk more about that.
I just wanted to stress the point that EKTAA made, which we've also made, namely that the NHI could actually worsen inequality between urban and rural. Because if the private facilities, which are largely based in big cities, get accredited, and a lot of the small rural facilities don't, this will just make the gap wider between urban metros and rural areas. So that means in our campaigning, we have to insist on priority being given to strengthening public facilities in rural and underserved areas.